technology. How is that going to play into the vision? And even more so, telehealth, reaching out in those communities, especially in a pandemic world, to where people don't have to travel here. If you don't mind touching on how that's been a component that you've implemented, and how that will play into the future of your vision.
It's interesting. Pre-COVID, we already had strategies to move into the telehealth, telemedicine technologies. Patients demanded. We need to embrace it. We did. What's funny, though, is you have your normal plans of how fast you want to implement telehealth in particular. And with government regulations, there really was a pull down of how fast health systems could implement telehealth. But when COVID hit and the federal government said, we are releasing these constraints, you go focus on what you need to do to take care of patients, we did something that I would, and my team always shares that I'm always pushing a little farther of where we should be and can be at a pace that I've always got to monitor, because there's always that speed of implementation and making sure your culture is not damaged by the speed for which you move forward. But we did something that was incredible. In a 2-week period, we had the ability from our IT and technologies, our physician engagement and embracing the change, to implement telehealth capabilities across all of our clinics in the counties that we're in. That's normally was predicted to be a 9-month process. So if you think 9 months into 2 weeks, wow. It also gives you, of course, they're like, now Stan, don't expect that type of intentional focus where we can make that type of move.
Always.
But when you look at it, it's just incredible when we can get everybody aligned behind what that needs to be. It was already part of our plan before COVID. It's definitely going to be something we continue to do. Patients expect it, patients demand it, and all the time in all healthcare systems, we have to reflect that while healthcare is catching up on technologies, all we have to do is simply look outside of healthcare and say, what do we demand as consumers of other capabilities in other industries, and just look at it and say, shouldn't patients and their visitors and the consumers of healthcare receive similar or better than that when they access points of care in healthcare? And we agree, they should, and we've got a lot of innovative things on the forefront. Same example or a related example, we, before COVID, were looking to launch Spot Saver. It's the ability that the app, you can actually, if you have a clinic appointment, you can tell us where you're at tied to making your appointments, and vice versa, tell us when you're ready for your appointment. You can do it from the convenience of your home, your car, et cetera. You don't have to sit in a waiting room waiting for your appointment. We already had that in the plans in the works before COVID. Conveniently, 2 months into COVID, 3 months into COVID, we launched Spot Saver. Spot Saver allows our patients and their caregivers to really wait in the comfort of an environment to where, from their mental capacity, they don't want to sit in a waiting room during COVID with other individuals. Some do. Confidently, we obviously require all the normal PPE and safety precautions for that. But anybody that says, you know what, I don't want to wait in a waiting room, we have Spot Saver that allows them to come right into their appointment at that time. So technologies, we have embraced it. We embraced it before COVID. It's been at a rapid pace since COVID, and it'll be with us ongoing.